Untold Physio Stories is part of the all-new PT Podcast Network. Find a new favorite podcast by an amazing PT content creator at ptpodcastnetwork.com. The future of medical documentation is here, and it's revolutionizing the way we record patient visits. Introducing Comprehend PT, the groundbreaking HIPAA-compliant AI scribe designed specifically for physical therapists. Imagine a world where the dialogue between PTs and patients is interpreted by AI into precise, real-time medical notes without lifting a pen or tapping a keyboard. Comprehend PT does just that, allowing healthcare professionals to stay engaged with patients rather than buried in documentation. Boost your efficiency, reduce claim denials, and liberate yourself from the burdens of manual note-taking with Comprehend PT. Join the revolution now at comprehendpt.com. Untold Physio Stories listeners get 50% off their first month with code MMT50, and there's a free trial available. Sign up now. I use it every day in the clinic for virtual and live visits. I just speak to the patient, and at the end, hit Comprehend, and a SOAP note's generated. I love it, and you will too. Welcome to Untold Physio Stories podcast, your perfect commute resource with physio failures, successes, interesting cases, and more from the physio and rehab world, with your hosts, Drs. Andrew Rothschild and Erson Religioso. 3, 2, 1. Welcome back to Untold Physio Stories podcast. I'm one of your hosts, Dr. E, with Modern Manual Therapy, Edge Mobility System, and Modern Rehab Mastery. My co-host is back, and with me tonight, it's Dr. Andrew Rothschild. How's it going, Andrew?
Good, Erson. How are you doing?
Good. It's been a while.
It has.
Man, lots of asynchronous. Hilarious about how you said that you wouldn't even have, that wouldn't have happened to you about the airport hero went.
Oh, yeah. I just kept right on walking by.
Yeah. Oh, look at these two poor fools.
Blinders on.
Yeah. They looked helpless.
Well, you're much nicer than me.
Yeah, well, I got some Starbucks and I got a 5-star Google review, so.
Oh, fantastic.
Yeah, it paid forward. So you have a story for us tonight.
I do.
What's going on?
And this is something I've never seen in 18 years of practice, and I looked up too when this happened to see what the incidence was, and it's incredibly low. I sent you a photo, so if you include that hopefully in the post when we post about this episode. But I have a patient. I actually just finished things up with him. So I've been seeing. I guess I saw him for a couple months, almost 3 months. Younger than me actually, so early 40s. He had a hip replacement. And I had seen him, which I was very surprised about, because I had seen him a couple of years earlier. He had a arthroscopy done, and he had done well. But so I was surprised, for someone that young, that whoever he saw.
Not to interrupt you, a hip arthroscopy?
Hip arthroscopy, yeah.
Okay.
Yeah, he had that done a couple of years prior, and had done well for like a labral tear, some cleanup. But it was one of those ones that it wasn't like from memory. It wasn't like a traumatic incident. It was more just a overuse type thing. But it's still one of those ones where I was like, I wonder how he would have done just conservative, not having had surgery. But I didn't see him, of course, till after the surgery. And then same thing here. He'd had a hip replacement, but at 43, he's very lean. He's a pretty active person. He's a lawyer. And he's not overweight, nothing like that. Not unhealthy. He's very healthy. So it was just surprising. But when I saw him after, just within the first week after surgery, he was having a lot of anterior thigh pain, like really like knee pain, really was having trouble straightening the knee. Like could not even do like a short arc quad because it was just so painful, but he also just like he couldn't do it. He was very, very, very apprehensive, like a lot of apprehension about moving, even like with passive motion of his hip and like, all directions, really guarded. And I think on the second visit is when I took this photo. He had crazy quadriceps atrophy, like beyond just normal post-surgical atrophy, which even with with hip replacement, you're not really expecting a lot of atrophy, especially in the quads. And he had sort of that the anterior lateral approach, and but it was just it was very striking quadricep atrophy. And my only sort of rationale was that there was somehow there was some sort of trauma to the femoral nerve, whether just from inflammation, whether from the surgical procedure itself, don't know. The surgeon, when he had a follow up with the surgeon really didn't confirm anything, wasn't really sure. But it was just, and you'll see from the photo, it was just really dramatic quad atrophy. He has kind of skinny legs anyway, but this is still significant. And just the pain and the difficulty he had with leg extension, very, very, obviously we limited hip extension, for a little while anyway, but even doing like mild, very unaggressive hip extension was really, really uncomfortable. And it took him a long time to be able to do even a straight leg raise. So that's why the rehab for someone very young with a hip replacement took over 3 months, just because it just had this extra layer to it that he really couldn't do it. He couldn't do an eccentric, like he couldn't go down a step without significant pain, and just did not have the eccentric control. Squats were very difficult. And it took a while before he could even do a full, resisted knee extension. So most of our rehab really was, obviously hip range of motion, but then really just working on quad strength was such a big thing. And he really has made significant improvement. So it was a point that it seemed like it was more like inflammatory related, almost like a neurodynamic issue from a mobility standpoint. But the fact that he had such pain as well, more not just weakness as you expect from like a radiculopathy versus like a radicular pain example in the spine. This was like the same version, but like just in the femoral nerve, just essentially from the hip to the knee. So yeah, it was just very wild, and I'd never seen anything like it.
So wait a minute, this picture that you sent me, is this before or after? Like,
This is second. This is his second day. This is the second day that I saw him. So this is like maybe a week and a half post-op.
Okay, so you don't have an after.
This is after the surgery. Yeah.
No, I mean you don't have a
current, like a
3 month. Yeah, 3 months in.
He went out of town on vacation. So I wasn't. It may not be his last visit. So I didn't. One of those ones I don't have a recent photo, but I need to get one to compare.
Yeah, for sure. So the surgeon never really. I mean, did you suggest that he had some sort of femoral nerve trauma?
Yes.
As a result of the surgery? Okay.
The patient,
do you have an anterior approach?
Yeah, anterolateral approach. Yep.
Yeah.
And the incidence is very, very, the incidence is like less than 1%. It's very, very low.
For this to happen.
Yeah, for this to happen. But,
yeah,
it was one of those things like, we talked about, should you get an EMG test? And I was like, you could get one, but it's not going to really change what we do. I was like, I'm fairly confident this is what it is, because there's really not much else I don't think it can be, given what you've had done and what your presentation is. But I was like, it's not going to change what we do. It'll just confirm the diagnosis, but it'll maybe give us an idea from a prognostic standpoint what we might expect, from a duration from things to recover. But he was like, yeah, I'm not really worried about it. I mean, I think the surgeon was one of those ones like, maybe either didn't want to admit that it happened or was just, would be surprised. Because again, it just is not so very common, but it seemed pretty clear that this is what it was.
It almost seems like it would be more common.
I actually surprised that it was as low as when I looked up the data. I was actually surprised it wasn't a little higher just with that anterior approach, but it's pretty low. So I guess that's a good thing.
Yeah, that is good. That is good. Yeah, I'm surprised. So he responded to basic strengthening, just like, so there wasn't like significant nerve insult. It was probably just irritating.
Early on, it seemed like it's like, oh boy, how's this going to go? But I think part of it also was just his more anxious demeanor, a lot of apprehension, a lot of guarding. He was more just really, he was very, guarding me from doing a lot of movement. So it was initially a slow slog. And so I was like, I don't know how long this is going to take. But then all of a sudden, once we got through that first month and really sort of gained some confidence that things were okay, started to see some progress. And then it really kind of then I knew it was just going to be a matter of time from a nerve healing standpoint, which, as we know, can take, 6 months longer sometimes. I mean, he's not all the way there, and he's not as good as he could be or definitely would be without having that happen from just a hip replacement, but he's definitely doing significantly better.
Yeah. Yeah. That's good.
He's pretty pleased. And he said his wife has noticed that it looks like his leg. I should have taken a picture the last time I saw him, but he said his wife noticed that it looks like his leg was like almost back to the same. I don't think it's quite that far yet, but it's definitely better.
Yeah. Well, if he went on vacation, maybe, and he's in a warm climate, maybe his wife can just take a picture for the after part. So,
that's
so
a
would
good
like
idea.
to post it this week.
He's in Costa Rica. I have his number. I can text him.
Yeah, perfect. All right.
Like, hey, no banana hammocks. Just keep it clean here.
Yes, I know. Yeah,
It's a family show.
This is a family show. My gosh, I don't want to see that. Yeah. All right. So, hey, thanks for the case. It's funny because I'm getting like deja vu. Did you send me this picture and we just never talked about it?
You know what? That's very possible.
Okay.
You literally, as you're saying that, I was like, did I send that back when it happens? I think that was when I first happened. I wanted to do an episode on it, and then that just didn't happen. So I must have sent it to you. Like, if you look, you may notice exactly. It would be probably within the first month that I saw him. So, yeah.
Oh, let me just scroll up my thread here. Let's see. It's a bunch of threads that's saying we can't make it. I can't make it. I can't make it. Okay, how about tonight? No, I can't make it. Let's do asynchronous. Well, we text a lot. Maybe it's on Google Chat or something, and not on iMessage. Now here's one about my dog passing away. Oh man, now I'm reliving all this grief,
all this trauma.
Yeah.
But you have a new dog, right?
I do, man. Yes, I am about to go upstairs. We're in the this one's having a bit more potty training issues than our last. I feel like our last golden only had like 1 or 2 accidents. This one's had like 4 or 5, but every single time it's always the owner's fault. It's like, oh, hey, who's let out the dog in an hour?
Right.
Oh, I thought you did. Oh, he just pooped. That's what he's barking at his poop now. That's what he's doing. But we did switch to a raw diet on the advice of the breeder and some other people we know who have lost dogs really early to cancer. And they said that one of the big advantages to this raw diet is like their stools are more firm and they don't smell. And I can actually tell you, they don't really smell. It's kind of amazing. So it's not nearly as bad as it could be. I mean, it smells about as bad as dog barf, if you know what that smells like, which is like not nearly as bad as human barf. Like I would say it's like 10% of human barf.
It does not tend to smell too bad.
Yeah, it's like kind of amazing because human barf smells so bad.
So awful.
Yeah, I don't know what it is. Like every time I clean it up, I'm like, this isn't that bad. So now, yeah, his stool actually,
I treat
about as bad as dog barf.
BPPV, and I tell the patient though, like if you vomit, I am walking out of the room. I will say that to patients. So I can't.
FYI, this could happen.
Yeah,
this could happen, but also this is what else is going to happen.
And I've been very thankful that is not. It's only happened once ever.
You haven't been vomited on.
Not vomited on, but the patient vomited just from from dizziness from BPPV.
Oh, okay.
If they vomit,
I've been vomited on. I've been vomited on.
I would go home. Like, I'm done.
Yeah, I mean, I don't even know what I did. I don't know if I had to change a shirt or what. It was like she was like, "Oh, I'm sorry, I just had Burger King." It was like burgers on me.
Like, nope, I'm done. See y'all tomorrow.
You're like, I don't even eat meat. Now you just vomited meat all over me.
Especially if it was meat. Like, yep, I'm out of here.
All right. Well, that's not even really an Untold Physio story because I just told it. But yeah, if any of you guys have encountered this super rare phenomenon of femoral nerve insult, which I'm frankly again surprised considering a lot of these are anterolateral approaches. I'm surprised it doesn't happen more often. let us know. Or if you've been vomited on, let us know. Come on, and maybe it'll be a more interesting story than mine. Mine wasn't BPVV. It was just severe pain, and I was doing repeated motions exam, and she,
Something worse.
yeah,
It's
yep,
unexpected.
it was gross. It was gross. Actually, I remember I ran to go get her a garbage can, and when I ran back in the room, she missed the garbage can and hit me.
Oh, that's even worse.
Yeah, I know. All right. Well, how can people find you, Andrew?
People can find me Instagram or Twitter at a Rothschild PT.
All right, awesome. Yeah, I was just putting together the Physio Roundtable website, and I noticed it still said Spear Physio. So I was like, I have to go check what this is now. I don't even know.
It's been years now. I've kept with the A Rothschild now for a good
Okay, okay, that's what I thought.
years.
I thought this was a little old. All right. Hey, make sure to subscribe to Untold Physio Stories. Give us a 5-star rating on Apple and